So my name is Dr. Juuso Blomster. I'm a cardiologist, and I work as an associate professor of cardiology in the University of Turku in Turku, Finland. And I also hold a position as a chief physician in the southwestern Finland hospital district, where I work as a chief physician in the research services. The background of the study is really coming actually already from 10 years ago when we started investigating different types of sensors. In this process, we actually quite soon realized that if we combine two common motion sensors, accelerometer and gyroscope, which are actually found in common smartphones, and when those sensors are placed on your chest, we can actually read your heart motion through your chest. And this was then, originally we started investigating this and validated against different types of echocardiographic methods, how to assess your heart. Tissue Doppler, strain imaging, even speckle tracking were used in these processes. And there's actually the background. When we were investigating this, we actually realized that with this kind of technology, it is plausible that we could detect those changes and signs of heart failure that develop during the disease, increased filling pressures, disturbances in left ventricular function. So these were the details that we wanted to investigate and initiated this bigger study, which was conducted in Europe and in the United States to address heart failure with mechanoelectrical sensors. The study design is really to understand these sensors and how they are recording your heart in different stages of heart failure. And this was actually addressed so that we enrolled patients who had acute heart failure, acute decompensated heart failure when they are admitted to hospital and are really in their acute stages. So the idea was to enroll these kind of patients within 24 hours when they're coming to hospital, then also follow them up until they are discharged from the hospital so that we actually see the acute phase when it's stabilized. And then thirdly, we wanted to also address individuals who have stable compensated heart failure. So for this purpose, we enrolled individuals who came for hospital visit or outpatient visit for their heart failure. And but also those individuals who had been hospitalized for their acute heart failure 3 months earlier. So we actually invited these individuals who we had already enrolled earlier for an outpatient visit where we examined them in their stable compensated heart failure stage. So these three stages were those where we were addressing heart failure, and we were actually addressing heart failure in both individuals with preserved ejection fraction and in individuals with reduced ejection fraction. So trying to understand the mechanistic features that we are able to identify these motion sensors in these two different types of heart failure and also in the different stages of heart failure from acute to the compensated heart failure. Well, the key findings is that actually these features and these signals that we are able to collect with the motion sensors, and then when we are comparing these to the hemodynamics, the filling pressures, those other specific details that you can see in heart failure, and then even with echocardiography verified findings, these are actually something that reflect in the features. And then with this, we are able to understand that there are specific features that are related to heart failure, and this is something that can be identified with this technology. So even though we realize that this is the first bigger study where we've been addressing this, the findings and the results are actually very promising. Digitalization in cardiac care is something that is coming, and when thinking about the healthcare disparity, especially thinking about these different types of minorities, rural areas, for example, where the access to care is limited. So when thinking about these and thinking about how broadly, for example, smartphones are available, the idea that smartphones could be utilized for screening tool or for a follow-up tool, for example, in heart failure when assessing cardiac condition, I think it has a huge promise. It has a really significant impact, and our mission here is really to take this forward and really bring a tool for colleague physicians to be using and addressing heart failure patients, so that the care could be improved even further what it is today. For further research, I would say that we would need a more studies on the topic. So what we have at the moment is clear that we understand that what features and what is the condition that happens there when we're using these motion sensors and addressing your heart in different stages of heart failure. But as you know how cardiology and our medical scientific world works, we need more evidence on the topic. So we have now one study showing that there's results are good and there's great promise. But overall, what I would say that we need in the future really is more studies on the topic, so that we are able to provide that robust level of evidence addressing cardiac patients, heart failure patients in different conditions, so that we are able to show that this technology can be helpful in identifying heart failure patients. Early detection is definitely one of the areas where I can see in the future where this kind of technology has the promise, but also thinking about heart failure patient follow-up. As we know that individuals with heart failure, they have increased risk of developing new decompensated heart failure. So understanding these individuals and how we would be able to address them with this technology, I think those are the two key areas where I would like to see more clinical studies happening in this area. And actually, our team back here in Finland is happy to collaborate and participating in the studies around these topics. But I think these are the ones that we need when we are really aiming to have a significant impact for patients and for healthcare. So this is where digitalization in cardiology especially is going, and I'm really excited about the future in that sense.